Osteogenesis imperfecta is an musculoskeletal disease condition. Look at this picture: bone fractures and X-ray findings. Look at this, and CT scan. A detail going on. Introduction. Osteogenesis imperfecta (OI), also known as brittle bone disease, is a rare genetic connective tissue disorder characterized by bones that break easily, often with little or no trauma. It results from a defect in the production of collagen, a key protein in bone structure. The condition affects both children and adults and varies greatly in severity. Definition: Osteogenesis imperfecta is a hereditary disorder caused by mutation in the genes responsible for collagen production, primarily COL1A1 and COL1A2, leading to fragile bones that are prone to fractures and deformity. Etymology: the term osteogenesis imperfecta is derived from Latin and Greek, where osteo means bone, genesis means formation, and imperfecta means incomplete. Thus, it literally translates to imperfect bone formation, reflecting the conditions hallmarks of defective bone development and fragility. Epidemiology: osteogenesis imperfecta affects approximately 1 in 15,000 to 20,000 live birth worldwide. It occurs in both males and females of all ethnic backgrounds, with type 1 being the most common and least severe form. Types: there are at least 8 recognized types of OI, classified based on clinical features and genetic mutations. The most commonly referenced are 1. Type 1, mildest and most common, characterized by blue sclera, few fractures, and normal lifespan. 2. Type 2, most severe, often lethal shortly after birth due to multiple fractures and underdeveloped lungs. 3. Type 3, severe, many fracture, short structure, and skeletal deformities. 4. Type 4, moderate, bone fragility with normal scalar and variable deformities. 5. Type 5, moderate severity with hyperplastic callus formation and calcification of interosseous membranes. 6. Type 6, similar to type 4 but with different histological bone features. 7. Type 7 and 8, caused by mutations affecting collagen processing, leading to severe symptoms and growth retardation. Causes: 1. Genetic mutation in the COL1A1 or COL1A2 genes. 2. In some rare forms, mutations in other genes involved in collagen modification or bone formation. Risk factors: 1. Family history of osteogenesis imperfecta. 2. Parental carriers of defective collagen related genes. 3. Autosomal dominant inheritance, most types. 4. Autosomal recessive inheritance, rare types like 7 and 8. Complications: 1. Repeated bone fractures and deformities. 2. Hearing loss. 3. Scoliosis and kyphosis. 4. Respiratory problems. 5. Joint laxity and chronic pain. 6. Dental issues. 7. Psychosocial impact, low self-esteem, social withdrawal. Pathophysiology. Pathophysiology of osteogenesis imperfecta, step-by-step process. 1. Gene mutation occurs. A mutation happens in the COL1A1 or COL1A2 gene. These genes encode type 1 collagen, the main structural protein in bone, skin, and other connective tissues. 2. abnormal collagen production. The mutation leads to either reduced quantity of type 1 collagen seen in milder forms, example type 1, defective collagen structure seen in more severe forms, type 2 or type 3, 3. Weak bone matrix formation. The abnormal or insufficient collagen disturbs the formation of a strong, organized bone matrix. This results in poor mineralization and structural weakness of bones. 4. Increased bone fragility. Bone become thin, porous, and prone for frequent fractures under minimal stress or even spontaneously. 5. Skeletal deformities develop over time. Repeated fractures and improper healing leads to bowing, short structure, spinal deformities, and joint laxity. 6. Secondary tissue involvement. Tissue that also rely on type 1 collagen, example sclera, teeth, ligaments, and inner ear bones are affected, causing blue sclera, dentinogenesis imperfecta, hearing loss, hypermobile joints. 7. Chronic and systematic impact. Over time, complications such as chronic pain, respiratory issues, and mobility limitations develop, affecting quality of life. This step-by-step breakdown explains how a genetic mutation lead to widespread structural and functional issues in individuals with osteogenesis imperfecta. Signs and symptoms. 1. Frequent bone fractures even from minimal trauma. 2. Bone deformities and short structure. 3. Blue sclera. 4. Hearing loss. 5. Loose joints and muscle weakness. 6. Barrel shaped rib cage. 7. Triangular face. 8. Brittle teeth. 9. Respiratory issues. Diagnosis. 1. Clinical evaluation. History of multiple fractures. Family history. Physical findings. Blue sclera. Deformities. 2. Radiological test. X-ray shows bone abnormalities and fractures. Bone density scans. 3. Genetic testing identifies mutations in collagen producing genes. 4. Skin biopsy to assess collagen structure under a microscope. 5. Prenatal testing in high risk pregnancies. Nursing diagnosis. 1. Impaired physical mobility related to musculoskeletal fragility. 2. Risk for injury related to bone fragility. 3. Chronic pain related to frequent fractures and deformities. 4. Disturbed body image related to physical deformities. 5. Knowledge deficit regarding conditions and management. Medical management. Bisphosphonates to increase bone density. 2. Calcium and vitamin D supplementation. 3. Growth hormone therapy in some cases. 4. Surgical interventions intermediately rodding to stabilize long bones. Corrective surgeries for deformities. Nursing management. 1. Handle patient gently to prevent fractures. 2. Educate family and caregivers on safe handling techniques. 3. Promote physical therapy to strengthen muscles and improve mobility. 4. Use of assistive devices, braces, wheelchairs. 5. Monitor for signs of fractures, pain, and respiratory complications. 6. Psychological support and education. Treatment options. 1. Pharmacological, bisphosphonates, pain management, NSAIDs, acetaminophen. 2. Surgical, rodding surgeries, spinal surgery for scoliosis. 3. Rehabilitation, physiotherapy, occupational therapy. 3. Orthopedic supports, braces, splints, wheelchair. 4. Genetic counseling for families. Psychosocial medicine. 1. Counseling and therapy supports children and families in coping with chronic illness and physical deformities. 2. Peer support groups encourage interaction with others facing similar challenges. 3. Educational support, individualized education plans, to accommodate physical limitation in schools. For family education, teaching safe handling, mobility aids, and emergency fractures care. 5. Recreational therapy, promoting inclusion in safe, adapted recreational activities to enhance social and emotional well-being. Prevention: 1. Genetic counseling for prospective parents with family history of OI. 2. Prenatal testing in high-risk pregnancies. 3. Avoidance of high-risk activities that could lead to fractures. 4. Early treatment and monitoring to prevent complications. 5. Regular physical therapy to maintain mobility and bone strength. In conclusion, osteogenesis imperfecta is a lifelong condition that presents significant physical and psychological challenges. While there are no cure, early diagnosis, comprehensive medical care, rehabilitation, and psychosocial support can greatly enhance the quality of life. Interdisciplinary management involving physicians, nurses, therapists, and counselors is crucial in helping individuals with OI lead fulfilling lives despite their physical limitations. Thank you. Have a nice day.